Step 1. The first step in applying a modified Robert Jones is to apply tape stirrups to each side of the foot, covering the length of the foot, with about 6 inches of excess extending from the end of the foot. It helps to make a tab at the end so the pieces can be easily separated when it is time to adhere them to the bandage. The purpose of the stirrups is to prevent the bandage from slipping off the patient's leg. Step 2. Once the stirrups are applied, the next step is to place the non-adherent Telfa pad against the wound. Because this pad is non-adherent, it will prevent the bandage from sticking to the wound. If the pad is too large, it may be cut to a size more appropriate for the wound. Step 3. The second layer of the bandage consists of cast padding. The thickness of this layer can be modified based on the amount of drainage from the wound or the amount of compression required to control hemorrhage. The cast padding is unrolled smoothly without folds or wrinkles, starting at the level of the toenails and proceeding up the limb. Be sure to leave the middle 2 toes exposed for future evaluation. Padding should be overlapped by 50% with each pass of the roll. A secondary layer that is too thin will slip easily, so it is important to apply at least 3 to 4 layers of cast padding. Step 4. Once the desired thickness of padding has been applied, elastic cling gauze is applied from the bottom of the limb to the top, with the same 50% overlap as used for the previous layer, using even compression. After the cling gauze is applied, the stirrups should be attached to the sides of the bandage. Step 5. Finally, the outer protective layer is applied using the same technique. This layer must not touch the skin directly because it can damage skin. It is very important not to apply this layer too tight. Splint application. If the patient has a broken limb, a splint may be applied for stabilization so the patient can be transported to a veterinary facility. Splints are incorporated into a modified Robert Jones bandage. Please begin your bandage on the leg that the splint is intended for. Begin by following the first 4 steps learned in the modified Robert Jones. Number 1. Apply tape stirrups to foot. Number 2. If a wound is present, cover it with a Telfa pad. Number 3. Apply several layers of cast padding, be sure there is plenty of padding over bony areas to prevent the splint from causing any sores. Remember to overlap each pass by 50%. Number 4. Apply cling on top of cast padding in the same manner. It's time to add the splint. After the splint is in position, it is held in place with another layer of cling gauze. Be sure to pull this layer tight enough to firmly anchor the splint to the leg. Number 6. Finalize the bandage with the outer protective layer of cohesient wrap. When evaluating the patient, it is important to check for excessive tightness of the bandage. Any chewing on the bandage or lameness may be evidence of a problem. It is important to check the middle 2 toes that were left visible outside the bandage. Evaluate for redness, swelling, discharge, or odor. If any of these signs are present, it is evidence that the bandage is too tight and should be replaced. The bandage should be evaluated a minimum of twice daily, and if no complications are observed, the bandage should be changed at regular intervals. For wound management, change every 1 to 2 days, whereas splints may be changed every 5 to 7 days. This splint is reusable, and if bandage changes are required, the splint may be gently cleaned and dried and replaced in a new bandage. It is also very important that the bandage stay clean and dry. Be sure to cover the foot with a moisture barrier, such as a plastic bag, when walking the patient outside. Remove the bag upon returning inside to prevent humidity buildup.